Hello, thanks for everyone. Thanks everyone for joining in today at the Gordon Museum. It means a lot to have everyone here, especially who can travel from far to be here today. I'd like to also thank people joining in online from the various countries. And today is essentially the first international collaborative grand round. It's quite a grand title, but what does it actually mean? So when I was traveling on my elective through different countries, I was able to be part of, or be a medical student in a grand round. And I saw how things were done differently in different places and how things are more traditional in some places. But the similarity between all of them was that it was just in that room or in that lecture theatre. The conversation didn't really progress out of there. So I thought it'd be useful to combine social media and technology essentially to get everyone to collaborate together and to join the conversation. And today I'm really lucky to have Dr. Kerry Boardman and Dr. Kayleigh Green from QMEC and the QMEC team online to help deliver this session today on clinical reasoning. It's something I'm going to learn a lot from today, and I hope everyone else will too. So I'm just going to pass on to Mr. Bill Edwards just to give a brief introduction to the museum and to himself.
Hello there, my name is Bill Edwards. I'm the curator of the Gordon Museum here at the Guy's Hospital campus of King's College London. And it's a delight to have you here, electronically or reality. I hope this first experiment will work well, and I think we've got a lot to learn here. And hand you back to Mr. Setley.
Thanks very much, sir. So just passing on to Dr. Boardman.
Hello to everybody who's in the audience here, and also to the people who are watching this on the internet. As you may have noticed, we don't have the best picture quality in the world with this shot at the moment. What we're going to do, rather than subjecting you to a slightly wobbly video of me flicking between the audience and here and on the internet, we're going to actually be broadcasting some slides for you and doing voiceover. So hopefully that will be a little bit easier to follow. The idea with this is that we really want your input, and that's people in the room and people further afield for us. So what we're going to do is to introduce you to a fairly typical GP complex or undifferentiated case. And we're going to ask you for your thoughts on this case. The difference between this and a traditional grand round, or certainly traditional UK grand rounds, is that what we're not doing is presenting you with a weird and wonderful diagnosis at the end, which was a rare thing and a sort of one-off chance to see it. What we're presenting you with is something fairly typical that you may come across, particularly people doing community medicine or any kind of primary care, or people who are at the first point of contact for patients. And we'd like to get you thinking about the clinical reasoning process. So what do we do in order to either reach a diagnosis or manage a patient where we don't yet know what the diagnosis is? So we've introduced our venue, and just to show you a little bit of this, and it's to demonstrate the historical venue that we're working from. So we're very privileged today to be in the Gordon Museum at Guy's Hospital, London. And we've also introduced who we are. So I'm representing the King's Undergraduate Medical Education in the Community team, and we're the community team at King's College London. And we're very grateful to Rajiv to have invited us along to this. We're working with the student-led GKT MedEd team, and you can follow us with either of those Twitter handles and using the hashtag ICGR1 for International Collaborative Grand Round 1. So if you put that on any of your tweets, then hopefully we'll be able to see you. And if you want to sort of see what we're doing, so follow GKT MedEd. So the case that we're introducing you to is a 50-year-old woman with nausea, dizziness, lightheadedness and unsteadiness. So she wakes up one Saturday morning with those symptoms. And so our first question is, what are your, in your healthcare system, and we're interested to get a global perspective here, how might this patient first make contact? So for those of you in the room, if you want to use Mentimeter to answer, then please go to that website, put in the code and pop your answer in there, and that should come up on screen. We know we've got about a minute delay between me talking and everything coming up on the internet, so we'll give it a little bit of time. And hopefully for those of you who are watching this on the internet, if you get this coming up, then start to put your ideas into either Mentimeter or start a tweet with @GKTMedEd #ICGR1. And we'll go over to a tweet deck in a second and see what kind of comments we've got coming in, and hopefully find that we're not talking to nobody out there. So we'll give you a little bit of time. So in the UK, we've already got an answer here that the patient would probably make contact with their GP. Does anyone want to just expand on that? How you think the patient might access the GP? Would they come into the surgery? Would they phone up? Would they request a home visit? What kind of things might be the case? Okay, so we've got somebody from the audience here, and I'm just going to repeat that for the benefit of people listening online who won't hear the comments in the room, that if it's very severe in the UK, then the patient may well phone up the GP and request an emergency appointment, either at the surgery if they're able to come in, or actually requesting a visit if they're so unsteady and dizzy that they can't make it to the surgery. And we've got some other things coming in here then. So in America, it might well be the emergency room that they present to. Interesting comments about friends and family. So thinking already about people's kind of social networks, not necessarily online social networks, but their support networks at home. So we're getting lots of answers about GP and emergency room. They might call an ambulance. They might call the telephone triage 111 system, which here in the UK means that you get some phone advice from usually an untrained person who follows through a protocol and will then give you some advice on where you go. Shall we have a look to see if we've got anything coming in from Twitter yet, or nothing yet?
So let me go over to the tweet deck. So we'll wait till we get some tweets through. I think it's coming through on Mentimeter more easily.
Might still be tuned into the old account.
Yeah.
Yes, exactly. There may still be. So do tweet the new one. Sorry. Where were we? It was here, wasn't it?
Yeah.
Is that right?
Mm-hmm. So for those of you in the audience here, while we're just waiting for things to come through on Twitter, imagine this patient has phoned through and you're the triaging doctor in general practice, and the patient's phoned through saying that she's dizzy, she feels sick, she's finding it difficult to walk. Has anyone got any suggestions on how you might initially approach this, just with regards to the appointment? So how are you going to work out what kind of appointment she needs? Does she need to be seen face to face or not?
Does she have a severe headache or any neck stiffness?
Okay, so we've got already some questions about, you might need to take a little bit more history from this patient to try and determine how urgent this is. And we'll come back to specific symptoms in a little while.
Can she safely get to the GP?
Yeah, absolutely. So safety is another important consideration there, isn't it? Can she safely get to a GP, or is she so unwell and is she on her own, and does she need a home visit? And it'll be interesting if we've got things coming in from other people, whether we hear sort of whether you do home visits, because I know in Australia it's quite rare for GPs to do home visits, whereas here in the UK, obviously we do that quite a lot. Check if they're insured. Oh gosh. So for people who don't have an NHS like we do, that may influence the pathway. Have we got anything coming in on Twitter? Right, okay. So would it be sensible for us to just do a quick recap for people that are just joining us on the new Hangout? So we're just presenting a slightly different grand round here, and apologies to everyone in the room who's heard this already. We're going to be discussing a fairly typical GP case, thinking about a fairly common presentation, with the focus today very much on clinical reasoning and how you get to a management plan, possibly a diagnosis, but certainly some kind of initial management plan for a patient, rather than focusing specifically on a rare and wonderful presentation. We're hoping that the difference today is going to be that we're getting some collaboration from people watching online, as well as from the audience members that we've got in the room here today. And we're going to try and work through our case. So the case that we're presenting is a 50-year-old lady